Breast cancer is now the most common form of cancer amongst women in India. But even with so many affected, there's still not enough awareness around it. Many women hesitate, even feel ashamed to talk about it because of the stigma and fear. This hesitation means fewer conversations, fewer early detections, and more lives at risk. But we can change that with one conversation at a time about what breast cancer is, the treatments that are available, and most importantly, the fact that getting breast cancer does not mean it's the end of the road. It's just a part of your journey. Our podcast, Hope and Healing, is a part of Easiest Exam, a public initiative by Zydus Life Sciences that aims to spread awareness about breast cancer and its early detection through a simple self examination. You can log on to easiestexam.com to know more about the initiative and be a part of it. Today, we are joined by Dr. Senthil Rajappa, medical oncologist at Indo American Cancer Hospital and Research Institute, Hyderabad. With more than 20 years of experience, he has been a part of countless such journeys of hope and resilience. And he's here to share his experience and understanding around the breast cancer journey from early detection to treatment and recovery. To begin with, I'll ask you a very, very simple question. No matter how lame, how simple it may sound, but it has a deep impact today. What exactly is breast cancer? How does it develop in the body of a woman? And is it also prevalent in men? Sorry, I asked you three questions in one go, but yeah.
That's all right. It's a pleasure to be here today. So I will try to give you the simplest answer possible to that question. So any uncontrolled multiplication of cells in the body is referred to as cancer.
Okay.
God has given us such a lovely system wherein everything has a check and a balance. So when these checks and balances are lost for multiple reasons, some known, many unknown, this leads to cancer. And when this uncontrolled multiplication happens in the breast, it is breast cancer. So that's as simple as it can be. Now, can breast cancer develop in men? Yes, it can very much develop in men.
Right.
If we see 100 to 150 women with breast cancer, for those 150, you will have one male who you will see with breast cancer. And in male breast cancer, there's a high preponderance of hereditary breast cancer, and it's almost mandatory to check for hereditary breast cancer if you see a male with a breast cancer.
Right. So even in women, it's hereditary, but I guess it's only 1 in 10 is what the statistics say.
Correct.
And only one is hereditary amongst the other 9 cases which have actually happened, which is actually shocking because usually you associate these diseases with hereditary. But since it's not hereditary, and you said some factors are known and some factors are unknown, can you just help us understand in the most simple terms what are the known factors and what are the unknown factors?
Okay, so just to broadly classify them, we usually use the term modifiable and non-modifiable risk factors.
Right.
Right? For example, being born itself is a risk factor to develop a disease. It's as simple as that. So being born, having a family history of breast cancer, having a genetic predisposition to breast cancer, which is hereditary, these are generally classified as unmodifiable. You can't do anything about it. You've been born, you've got your parents, you've got a family history, you've got your genes. So nothing can be done about these.
I hear you.
But there are many things that we can modify. And what are these modifiable ones? Lifestyle. Today, breast cancer is being called a lifestyle disease. And we now think that a lot of the reason for increase in the numbers of breast cancer patients are related to lifestyle. So that's one, which is alcohol, lack of exercise, bad diet, smoking or tobacco in any form for that matter, and so on and so forth.
Right.
The other is, reproductive or hormone-related factors. Some of these are supposed to be protective. That means if you have many children, if you have your child early, if you have breastfed your child for a longer period of time. So these are all protective. So everything other than what I said becomes a risk. That means if you start your family very late, you have less children, you've not breastfed. So these are risk factors. But I think the point we have to make at the end of the day is that whenever a lady is diagnosed with breast cancer, the first thing that she will ask is, why did I get this?
Yes.
And I have to say that in 90% of women, we may not be able to pinpoint one factor and say, this is why you got it.
Yes.
So we know a lot about it, but to say why one lady got it is almost never possible.
So you say it's multifactorial.
Absolutely. In fact, sometimes, when you look at science, you start saying it's so difficult to get cancer because so many things have to play and come against you for you to end up getting
Imagine. So
one.
it's difficult to get cancer, meaning you are doing something wrong on multiple levels for it to have a cumulative effect. And one of the things that you said is lifestyle, which includes sleep, also food, nutrition, exercise, mental health, would you say?
Absolutely. I think you see that mental health is probably not directly related as a causative event. These are associations. So for somebody who's not exercising, somebody who is taking a lot of alcohol, somebody who's addicted, should I say, because there's a lot of difference between just having a drink versus being addicted, somebody who smokes a lot, these are associations that come along with stress.
Right.
So stress is not directly a causative factor, but all the other things that usually are associated with the so-called, stressful life are all causative factors that we know, and these are high risk factors.
Right. One thing that I've known in the journey of this disease and the prevention and the cure and the therapy and all of that is that estrogen plays a very important role. When the estrogen goes high in women, I think cancer cells feed on estrogen. And when you said when it comes to men too, is it the same? Is it that in their case also is high levels of estrogen, which is the causative factor? It's only hereditary.
No, it is also partly the causative factor. Hereditary is only part of it, it's not the whole.
Right, right.
Yes, indirectly, because the hormone therapies that we use in women with breast cancer are also used in men with breast cancer.
Right.
So, yes.
So what would you like to tell our young adults? Because now we are in an age of Instagram and there is so much information being bombarded at us. Some which makes sense, which is substantial, and some really cause fear. Then they list out, this is the reason you should not do this for your daughter or your son, and it keeps going on. And then you keep saving those reels and the algorithm makes you go mad. But I just want to ask, what would you like to tell the young adults? Because we've also come to know there are 18-year-olds, 20-year-olds, 22-year-olds who are being detected with breast cancer. Is it to do with the products and the foods that we're eating? At time, there are certain products, cosmetics, which play with your hormones. Does it have an effect? Does it have an impact?
Every risk factor or causative factor for breast cancer ultimately works through hormones. Some of them are directly toxic to the genetic material of the cell. For example, tobacco.
Mm-hmm.
Okay, tobacco does not cause breast cancer or is not a risk factor for breast cancer based on hormones.
Right.
Tobacco has a lot of cancer-causing agents which end up damaging the genetic material in your cell,
Right.
which sometimes can be repaired. And that's how you escape cancer even though you're smoking. But there may be situations where that alteration in the gene that has happened because of tobacco exposure cannot be corrected by the mechanisms in your body.
Right.
As I started by saying, we've got a super body where all the abuses that we do get corrected so beautifully. But if something goes wrong there, then you end up having a proliferation, a multiplication of cell.
Proliferation is right. It's also fine.
Lovely.
Yeah.
So that can happen and you can ultimately end up with breast cancer. So there are a lot of carcinogens that we knowingly, carcinogen is a cancer-causing agent.
Yes.
It may be a chemical, and so many things.
Right.
So knowingly or unknowingly, we are consuming a lot of these.
Yes.
And you're absolutely correct when you said that they can also be one of the reasons for cancer causation, especially the increase that you're seeing in younger women.
Because
in this
it's
country.
doubled in India in the last 20 years. What would you like to say about the number of cases, particularly increasing in India itself?
I think there are two broad reasons, again, that you can look at this with. One is an apparent increase that I call it as. The second is, and this is the one that I think is more important, is the underlying causes. So, the underlying causes, as I said, are the genetic factors. So, the genetic factors that are causing breast cancer, they are Now, what is the apparent increase? We are seeing women coming to get investigated, getting diagnosed, getting treated. There are more people coming to the hospital because there was a time when you saw a lump, you wouldn't come. And then
Right.
it increased to a point where you can't do anything. So you decided not to come. We weren't able to diagnose them on time. Facilities were not available, so they wouldn't come to the hospital. The moment you make a diagnosis, the first thing they would think is the world comes crashing down,
Yes.
right? And somebody would say, no, there's no point in treating cancer. So you wouldn't get to the hospital. The government has put in a lot of schemes where treatment is done free, so more women come to the hospital. Only if you come to the hospital, you're being ticked as a cancer,
Right.
Till the time that you're in the community, you're not being counted as one. So I think one of the most important reasons for this big increase is that more women are coming to the hospital.
Screened. They're getting
Yes,
screened more.
screen, getting diagnosed, whatever that is. So this
Right.
is one part of the story.
Right.
The other issue is the lifestyle issue that we
Yes.
spoke about. So we kind of abuse our bodies,
Yes.
right? We treat it so badly.
Mm-hmm.
So that can end up causing. The third is, we always keep saying that there's sudden increase in the number of young women with cancer.
Yes.
Again, partly apparent because India is
apparently younger people are strong. Their immunities are the immunity level is better than a 40 or a 50-year-old, and even if it's not hereditary for them, how and why does it happen to an 18 or a 22-year-old?
Lovely question. So the reason why we think that there's a sudden increase in the number of young women is that India is a young country.
Yes.
Right? So if you're in a country that's young, you're likely to see these diseases in the younger population.
Yes.
Right? So if you look at something that's called as an age-adjusted incidence or rate, for that decade of life, it's not very different from what it is in the West.
Right.
Right? In general, our incidence is much lower compared to what it is in the West.
Oh, really?
Yes, but the sheer numbers because of our population are much higher than the West.
I get you.
Incidence is counted as number of cancers per 100,000 population.
I get you.
That is vastly lower compared to what it is in the West. But even with this low incidence, the numbers are very high. So in a young country like ours, the bulk of the population that is likely to get affected is going to be young. So it looks like as if everybody who's walking into your cancer clinic is young.
Yeah.
But if you look at the incidence per se, it's not a big difference. So that's important.
It is a little disheartening to see young people. In fact, it's just disheartening to see
Anybody.
anyone enter the oncology department. But I think one pertinent thing that you said right now, which most of the doctors, when you speak to them, at least things have changed drastically over the past 5-6 years, because I think it's a very rampant disease. So the research is also really, really fast and happening, and more updates and developments are happening. And so the doctors sound different from how they sounded 5 years back and 6 years back. Now, when I talk to the doctors, they're really talking about lifestyle changes. They're really talking, even a fit person who goes to them, they're actually talking about stress. And they're also talking about sleep. They're talking about alcohol consumption. They're talking about all of this. Prior to the last decade, it wasn't happening much. But I also believe there must be studies corroborating the same thing, maybe, perhaps, because like you said, if it's not hereditary, then why is a certain person or certain population getting it? It's not an infection. I guess by now we all know that one way to prevent breast cancer is go for an early breast cancer detection. And awareness about that is much needed. And podcasts and forums like this encourage it. Also, Zyrus has come up with a public initiative, and it's called the Easiest Exam. It helps you figure out how you can self-examine yourself. But if you can elucidate on the same.
This is a lovely campaign. So what it does is, one, it makes this lady aware that she can get this disease. Her risk might be very variable, but yes, it is a fact that she can get it. Number two is, if there is a lump, you tend to pick it up early compared to somebody else who's not doing breast self-examination. And there is some scientific data to support that. What do? It's a very organized way of examining your breast. You fix up a day of the month. That's generally 4 or 5 days after your menstrual period, because your breast is most supple. you have the least discomfort in putting gentle pressure on your breast and examining it at that point in time. So what you do is you use your right hand for your left breast and vice versa. And then you gently start from the armpit and go very gently palpating. Okay? You're not supposed to put pressure. That's number one. Because if you put pressure, especially in a young lady, what you will feel as lumps are the small fat
Yes,
globules that are
deposits.
there
Yes.
below the skin. So, you get alarmed and then you run. So you go in a circular motion around, starting from the armpit, go around the breast, and then end up in the nipple areola. So this is a simple way of doing things. What also is very important is to inspect your breast. So just before you have your bath, when you're undressing, you stand in front of the mirror and observe your breast for a couple of minutes, because you are the one who knows your breast best. Look for any changes starting from the skin, discoloration, any lumps that you can see, any asymmetry in the breast that you're able to make out. These are very important things that you
Any
have
discharge.
any discharge. All of these things are to be seen, as an observation. And then when you're having your bath, when you're soaping your breast, that's again a time when you can just run your hand over the surface when it's very smooth with soap there, wherein you're going to be able to make out those small bumps better.
Mm-hmm.
So it's just that you concentrate a little bit one day of the month. You choose that day based on your menstrual period so that you can pick up these lumps early, because we know that if you pick it up early, then the treatment that you require is going to be very little and your probability of cure is extremely high. It's better than tuberculosis.
Yeah, is what I heard, 97%. Right?
Exactly. So that is the reason why this easiest exam campaign is very, very important.
That's lovely. Thank you. Explained so well and simplistically. My next question would be to understand mammogram. Very honestly, a lot of people are scared because of the radiation it emits. Then they absolutely don't know what. Of course, a lot of women are self-conscious about letting somebody else touch their breasts, and how to tell them not to have this sort of an innovation. One, number two, how important is a mammogram, and what is a mammogram, and how often is it needed?
Okay. So a mammogram is an X-ray of your breast.
Okay.
Right. So what they usually do is they have a plate in between which they put your breast. There's some gentle pressure, there's some discomfort, but that's what is done in a mammogram.
It's not gentle, I want to say.
So I'm going to be convincing the lady sitting across to get a mammogram done. I can't say that, right? So that's what it is. Now, generally, along with the mammogram, they also do an ultrasound of the breasts.
Yes.
Now, why is this done? It's complementary to a mammogram, because as you grow older, the probability of a mammogram picking up a lump is higher, and vice versa. In a younger lady, because the breast is going to be dense, you find it a little difficult to pick up those density changes in the breast just on the mammogram. So you want to also do an ultrasound to pick it up. So that's as simple as it can be. Now, without getting into the controversy of a mammogram itself, if you decide to have one. Now, why am I saying the controversy?
What's the controversy around?
Okay.
I've never heard about a controversy around a mammogram.
Well, lovely. If you've not heard, so good. But
the only thing that I've heard is the inhibition because of the exposure.
Okay, so why the controversy is, is it worthwhile applying mammography as a screening tool in the population continues to be a controversy, because there are people who believe that you may be overdiagnosing, you may be putting women through a lot of tests that they may actually not
that's what's
need.
the radiation to
yes,
it,
the radiation exposure and so on and so forth. These are the controversies. We're not going to discuss that for today. We'll set that aside. That's for a different day.
I think that's also for a population.
Exactly. So that's for a population.
Who is not...
So just getting into the community and screening with the mammogram comes with a lot of controversies.
Of course.
But on an individual level, if you decide to get a mammogram, I think the first thing that you need to do is to sit with your physician, whoever that might be, and understand, one, what they're going to do. What is it that you're trying to pick up? What is the probability based on your risk that you may pick up something? And if you pick up, what next?
Right.
And are all lumps that are picked up on a mammogram malignant, Can it miss? I think you need to be counseled a bit before you get into
Of
any of
course.
these. So this is a very important part of the diagnostic process itself.
Of course.
When do you start getting it for an average risk lady? That means there's no family history, there's no genetic predisposition. You're
Nothing.
otherwise just walking into a clinic. I think it's reasonable to start at age 40.
That's
And
what
then,
a prerequisite is.
yes,
That's what doctors
so
say.
you get it once a year, once every other year at some frequency till you get to 50. And then you probably get it every year. And you can continue to get it till about 75. That's the general recommendation. But nothing prevents you from getting it beyond that, because if you have a life expectancy of more than 10 years from that date, you're still good to get another mammogram done. So there's nothing like an upper limit where you can stop.
Sure. So just sort of interjecting here. So if someone is predisposed to the condition, but of course hasn't been discovered yet, so that person should also start getting screened at 40 or earlier.
Excellent. So let's say somebody is carrying an abnormal breast cancer gene, wherein you're likely to develop this disease early. So there are two ways of looking at it. There are some people who will say start screening at the age of 25, right? 30. There's another school of thought which will say you start screening a decade earlier than the first person who had cancer in your family.
Okay, got it.
So these are two rules of thumb that we generally apply. But you're absolutely...
The choice is the patient.
Yes, I think, again, it's a discussion that you have with the patient. Why are we talking about 25 and all? Because we don't want somebody to have a test before the age of 18, because you want to first understand the implications of having a positive test, a negative test, and so many other things. So you should be, at least within inverted commas, you're supposed to be able to understand these things after 18. But, I believe that it's not certainly the case.
Right.
But having said that, that's the reason why you get tested after that, and then you get your mammograms done following that.
A lot of people, so this was about the population that I asked who are predisposed to it. But I'm also want to ask about section of the audience who are absolutely clear. There's no family history, there's no lump, there's nothing. But as just general awareness, like you said, after 40, they should get a mammogram done. So with God's grace, everything is clear. Are they still supposed to repeat year after year, or is it different for every patient?
No, I think the value of any such screening test, whether it's across the population or for the individual, comes with repeating it, right? We are saying you do it every year or every other year because there's a possibility that in that interval between two mammograms, you could have developed a cancer.
But that also means that entire population will go through the mammogram then.
That's right. So again, it comes to your pre-test probability of being able to pick up something. That's why I said you start this whole thing with a process of counseling, right? So if there is an average risk lady, all those that you described, you first have to sit and talk about what is the probability that you will pick up something and the implications of picking something up. There are always falsely positive lumps and falsely negative results that you can get. So everything needs to be understood clearly before you get into any screening test, because it is not like having a blood test to check your hemoglobin, right? Even that can be stressful sometimes, but having a mammogram needs for you to go through the whole process of understanding this, why not, and so on and so forth before you have it.
How do we take out the fear from it? Because clearly a mammogram can save a life.
Absolutely.
Many lives altogether. It's the only test that can actually supplement it with ultrasound, which can help you detect early breast cancer in general. But we all hope that everybody look up for signs and there's early breast cancer detection. But considering how we're speaking right now, it might be fearful, might instill fear. How do we take out the fear from people, from women and their families to actually go for a test? And if the doctors have actually told you to do a test, why do they not go to get themselves tested the next year? What stops them? It's the fear of supposing catching it on, or what if it comes back again? So that fear is always there. But getting the test is so much more important. Can you just share a few tips with people which takes away the fear of getting a mammogram test done if the doctor has specifically recommended you to do?
I think the objective behind getting a mammogram is to pick up something early. Now, why do you want to pick it up early? Because you want to be cured of this disease. So I think
Yes.
the first thing that needs to be stressed upon when you're asking somebody to get a mammogram is to say that I'm going to pick up a disease that may be precancerous, or it might be very early cancer, so that you may just get away with having surgery only, and your chance of a cure is nearly 100%. Okay. So I think this is, for me, the most important point that we need to make when we are asking
Yes.
somebody to get a mammogram. Even if you pick up a 2 centimeter lump, let's say, okay, that's slowly getting into stage 2. Anything more than 2 centimeters, stage 2. Even then, with the excellent treatments that we have available today, your cure rate ranges somewhere in the 90 plus percentages. And as I earlier remarked, it's better than many, many other diseases that we come across today. So you have to dispel this fear that every cancer means death, right? Today, in our country, nearly 60 to 70% of all women with breast cancer are cured. And in the urban, it might be 80, 90 plus,
Right.
while in the rural or the some parts which don't have access to many of these facilities, it might be a little less. But the point is that if you pick it up at a stage that you can treat it and cure it, then nothing like it. So I think this is the most important point that we have to tell our women who come to us to talk about a mammogram wanting to
Yes.
get it done.
Might as well get it done than not get it done. Might as well get it
Absolutely.
detected.
Absolutely.
At times I was just telling someone that, God forbid, it should not happen to anyone. But if it is to happen, please make the person aware of it, and please give the courage to the person to take action towards it. It becomes easier for the doctors to cure it. And like you
Absolutely.
said, it's just not treatable, it's completely curable.
Absolutely.
And
Absolutely.
the longevity increases. I want to understand the treatment in India versus other countries. We are also doing tremendous research. And this tremendous amount of population actually here to supplement your research studies as well. What is the treatment process and the progress here as compared to other countries? Are we up with the game? And I also want to understand a little bit about immunotherapy, which is fairly new in the field. So yeah.
So we are no different from the West. We are as good or probably better.
So that's great, because a lot
Okay.
of people who get and they say,
No.
oh, the privileged
No.
people are getting
In fact,
to
you
go.
want to see an oncologist tomorrow morning, you can see here,
Yes,
but you can't do that in the
but you
West.
can't do.
Okay.
Absolutely.
So starting from there are many advantages of being treated in this country compared to the West. So I'm very
Yes.
proud of that. So
So
that's
am
number
I.
one.
So am I.
Lovely.
And with
Thank
God's
you.
grace, my treatment too was done in India itself, very much in
Excellent. So
Bombay.
you're
So I think we're blessed with the best of the doctors, but still there's a misconception, if you have the privilege, go travel abroad because the research is better, the doctors are better, but I want to hear it from you.
So I think that is there for everything in life, right? So you always think that what you have next to you is inferior and you want to go somewhere else and
Yeah,
get
the
something
grass
that
is
is
always
probably
greener.
exactly. So you want to do that. That's got, it's not only in medicine, it's there in so many other fields. So I
Right.
think that is, we have to be proud of ourselves,
Yeah.
that we are able to do everything and anything that can be done anywhere else in the world for this disease.
Right.
So I think we are inferior to none. So
That's
that's
great.
something that I want to say. Point number 2 is access to medications can be a little variable depending upon where you are and what you need, right? But again, if you need something, ask your physician how one can access it. There's nothing wrong in asking for help.
Of
There's no
course.
need to think that it's expensive and you can't have it. There are so many ways and means of getting something that you probably cannot access otherwise.
I
There
hear
are
you.
so many good Samaritans everywhere who come to help every day in the hospital. They will
Yes.
come and tell us, Doctor, if you have somebody who needs a medicine that will cure them, please call me.
Yes.
I will come and fund their treatment.
Yes.
So please don't hesitate to ask for help, because many times in our psyche, we think it's below dignity to go and ask somebody for help.
Yeah. Yeah.
There's no need to do that. Every single medication is available here. In fact, it is extremely cheap to have those super medications in India compared to having it in the West.
Right.
And so many Indian pharma companies have made high quality, super good medications at a fraction of the cost.
Talking about which, I wanted to know, what are biosimilar?
We'll come to biosimilars. We'll finish with the immunotherapy and get to the biosimilar story.
Done. There's so much to talk
So, Immunotherapy is, again, I wouldn't say a new kid on the block. Now it's probably an adolescent or an adult because the first immunotherapy was approved somewhere in 2013. So it's
Right.
now about 11 years since the first immunotherapy for melanoma, which is a skin cancer, was approved in the US. So what this actually does is it helps your body to recognize your cancer cell and help your body's immunity to fight it better. That's what it does. It's not directly anti-cancer.
Right. Right.
Okay, so that's what immunotherapy is. And some types of breast cancer, we use immunotherapy
Is it
today.
enough or is it need to be
It's only
supplemented?
part of the treatment. You
Ah.
need your chemo, you need your surgery, and all those things. But it's part of the treatment. It's made a decent impact in curing women with triple negative breast cancer.
Or
So
it's morely for triple negative?
yes, as of now, that's where immunotherapy is used in breast cancer.
Right.
Biosimilars are, drugs which are very identical to the original drug, with some small changes which actually don't matter as far as the activity of the drug is concerned.
Okay.
Okay. So you have to understand drug development process and some of these administrative issues that regulatory issues that come around these, because those drugs cannot be made, a copy of the drug cannot be made here for various reasons, regulatory reasons, patents, and so on and so
Yeah.
forth. So when that expires, you do a biosimilar wherein you're tweaking the structure a little bit, which will not alter the activity. It'll keep the activity the same, but since it's developmental process, it's a little abridged. So you're able to get the same high quality drug for the fraction of the cost, because a lot of the drug
Oh, I get you.
development is expensive because of the way drug development happens. You have to start with some, animal experiments and then do many tests
Of
that
course.
will tell you that it's good to get to the human level. And then you have to do a large study,
Yes.
you know,
Has to be
randomizing
tested on a-
patients.
yeah.
So drug development is expensive. So the way a biosimilar is developed is an abridged version of that, but it's a scientifically robust development. So we should not think that the abridged development is scientifically flawed.
And it's cheaper.
Absolutely. So since the development is robust, abridged, it's a different pathway to approval. We get it at a fraction of the cost, but the quality is as good.
It's the same chemo drug.
No. So biosimilar is typically used in a situation where you are doing a monoclonal antibody,
Mhm.
which is, broadly called a biologic.
Yeah.
Right. So a monoclonal antibody is the term where you use, where the situation where you use the term a biosimilar. So for a chemotherapy drug, the term that you use is called a generic.
Right.
Right. So that's the small difference. So this is a chemical entity. That's a biological entity. So for a biological entity, you're calling it a biosimilar because it's come from something that's called as a recombinant technology, where you put the gene for the production of that particular medicine into a bacteria,
Right.
and then you produce it from there. So that's the
Part
technology.
of the biotechnology.
Exactly. So that's why it's called a biosimilar. This is a
Right.
chemical entity, so this is a generic. So that's the broad difference.
I hear you.
That's as simple as it can.
But
sound.
we have access to it, and it's cheaper
Absolutely.
and again effective
Absolutely, equally effective.
towards breast cancers or all sorts of cancers.
All sorts of cancers, depending upon what the cancer is, what the biosimilar or the drug that we are talking about is, and what the clinical setting is. So there are multiple things. But the bottom line is, it's a robust process of development. It's highly effective. It's a fraction of the cost. So that's what is important.
That's amazing. So we were talking about the medicine part of it and the chemotherapy part of it, and we went really deep into our conversation. But very honestly, the first response of anyone who has been detected with breast cancer is fear and anxiety, um, almost as if a death sentence has been passed. What would you like to tell the people who have just been diagnosed? If you're supposed to, I know counseling is one thing, but as a doctor, from a very medical, practical perspective, if somebody has been detected, what is it that you'll tell them?
The first thing is face it head on.
Yes.
Right. That's, I think, the most important part of this whole process, because the physical difficulties of going through treatment are very temporary. The mind game, I think, is more important than the physical difficulty that somebody goes through. Because the moment you're diagnosed, the first thing that comes to every Indian lady's mind is, I'm going to die now.
Yeah.
Who's going to take care of my family?
Yes.
Her priority is not how will she save herself.
Yes.
I'm going to die. That's decided. How am I going to take care of my family? Who's going to do this? Who's going to do that?
Sure.
And then the second thing is it's going to be terribly expensive.
Right.
And I'm going to become bankrupt doing this treatment. And then I'm
course.
finally going to die. So this is exactly what goes through everybody's mind the moment they're diagnosed with this, irrespective of what cancer it is and what stage it is.
Right.
So the first thing is your disease has a lot of good treatments available today.
Yes.
And the key, as we were discussing earlier, is to pick it up early. If you're going to be able to pick it up early, your chance of a cure is nearly 100%.
Yes.
And there are so many ways and means of finding access to treatments that are available.
Yes.
We are as good or better than the West in delivering these treatments at a fraction of the cost and the resources.
Yes.
So you're going to be all right.
That's so lovely and heartening to know. And it's
That's about it.
2024. There are so many diseases and so much which is happening in life as it is. I think this is one of the most well-researched disease. The cure is there. The idea is just to show up at the doctor's
Absolutely.
clinic,
Absolutely.
just reach there.
Yes.
And then, like you said, acceptance is one thing, and then treat it like any other disease. Would you say that? Of course, there are repercussions. It's a long haul. It's not something like a 5-day antibiotic course.
Correct.
I think that's what the preparation is needed for. At times, it becomes more than a year for a lot of people, and it's different duration. But I think what you said is very, very hopeful. If
Absolutely.
it gets detected and you're coming in for your treatments, there's a great chance that you live a quality life.
Absolutely.
And that's
So
what everybody looks for.
you're absolutely correct. So educate yourself, make yourself aware of everything that you're going to go through in the next 6
And
months.
remove the stigma and taboo around it.
Absolutely.
Yeah,
So
like a lot of people have, a lot of women and men, especially Indian men and families, we're more of a not patriarchal. Okay, we are. You can't take that away.
I think in
But the
terms of
nu-
our attitudes.
But the nuclear setup is not there. We are a family of joint family. Of course, the metropolitans are different, but major part of India is still traditional household where there are the father-in-law, the brother-in-law. I think it's about time that all of us make it easy to say the word breast, to say the word breast cancer, to say cancer also. I remember 5-6 years back when I'm talking to people, they're saying, oh, the C word, the C word. And I was done with it. I was like, what C word and what B? The kids talk like that, when I'm cussing, Mom, you said the F word. So, and here we all are adults, say it for what it is and stop
Absolutely.
making it into such a, in Hindi we say hawa, don't do that. In fact, just say it so that you just downplay it and make it easy for the patient and the caregiver to sort of go to the doctor and treat it like any other disease. It's cancer, okay, but it's curable. There are medicines, treat it like any other disease. I really wanted to reiterate it. Sorry, I took your time to say
Absolutely
it.
fine.
I think it's very, very important to just say for what it is.
So the other point, just to take a cue from where you spoke, is that though sometimes your family can be a deterrent, but in the Indian setup, the family is probably one of the greatest strengths that we have.
Absolutely. There's so much of love and care.
Absolutely.
That comes from
So,
there.
that patient comes, 10 people will walk into your room.
Yes, yes.
For some physicians may not like it, but I like it.
Oh, that's
Because
so
for me, that
sweet.
makes my job easier.
Yes.
Right? So that support that this lady can get is simply incomparable.
It is
And I think we
incomparable.
should play to our strengths rather than our weaknesses.
So beautifully
If
said.
if your family is your greatest strength, get them all.
Get them.
Doesn't matter.
So sweet.
Doesn't
I've
matter.
seen usually in the West, बेचारे अकेले जाके
Exactly.
chemotherapy ले रहे होते हैं,
Exactly.
जा रहे होते हैं. I mean to say, of course, you have to do it by the end of it alone, but a support system always helps.
Absolutely.
And then we are blessed. So it's a perspective. One, that there is inhibition to say breast and breast cancer in a family with a lot of men. But if they overcome that and they accept that, then they become your biggest allies.
Absolutely.
And then in my case, very honestly, when I used to go for my weekly chemotherapy, My best friend was always there. So no, Indians, family bhi aa rahi hai, husband bhi aa raha hai, bacche bhi aa rahe hain. It's like a picnic. My mom would open a pulao ka dabba. I was like,
Exactly.
Mama, this is so embarrassing. She's feeding the nurses also. I was like, oh my God, like this is a chemotherapy session, guys. Let's treat it like that.
Correct.
But you're right. This is blissful.
That's
There's a
correct.
happy vibe that we Indians create around everything. So yeah, we truly are blessed to be Indians.
Absolutely. So something that happened this morning. So there is a elderly lady who comes for chemotherapy. She will come. The first thing she will do is go to the canteen and get a Mysore bonda first.
अरे यार मैं खुद अपने लिए डोसा लेती थी
Exactly. So
सच्ची
you
में
see that?
every Saturday
So
would be a masala
all of us
dosa.
are the same. All of us are the same. So I think it depends upon your attitude
Yes.
at the end of the day.
Yes.
If you decide that you want to take it head on and kill it, you can kill it. Right? And that's what I think every lady, every patient for that matter, should be taught to do. We should try to set some goals, short term, long term. Try to be realistic in what we're trying to achieve. I don't want to say that we're curing everybody,
Yes.
but there's a great opportunity. Pick it up early, get treated, get rid of it, and be a normal, useful citizen of this country. I think
So
that's very,
beautiful.
very important.
So beautiful. So heartening. Uh, just for you to say, be a useful citizen, I think each one of us is capable of adding value.
Absolutely.
And even during your treatment, if you're able to add value to your life or to the lives of the other people, it's a life worth living.
Absolutely.
Is there anything that you like to tell the caregivers?
So cancer is a disease, though physically affects the individual, mentally it affects the whole family, right? So as much as the world comes crashing down for the lady who's affected, it's as much for the family also. So everybody needs to be taken care of. But what's important for caregivers to understand is that they have to be with this lady who's been affected by the cancer all the time. I think so much more can be done by the caregivers than the medicines and the doctors.
Yeah.
And that's very important to understand. So, as much as the lady has to understand her treatment and what side effects and what not, caregivers also will have to go through this process of understanding
Yes.
the whole process. That's very important. Many times they end up enforcing unreasonable restrictions on the patient, starting from what she should do, what she should eat. For example, the first thing, there's an old lady that I saw this morning who came and said, Doctor, she's a Gujarati lady, and they've stopped all her desserts.
Oh.
Can you imagine? That in my mind is criminal. And the reason for stopping it is because if you eat sweets, the cancer will take all the sugar and it'll start growing.
Yeah, I just to that. There's
Okay.
so many
So that is-
doctors also talk. So my doctors never spoke of that. Very
So
honestly
your doctor
speaking,
is a super doctor.
I agree. My
Excellent.
doctor. I really want to take this moment to mention Dr. Mandar Natkarni. He's
a good friend.
He's a good friend of yours. He was my oncosurgeon and a very amazing man, a healer, and I'm getting the same vibes from you. I think it's
Thank
so
you.
important, for doctors to be positive.
Absolutely.
Like you said, you let the entire family come for the chemotherapy because by the end of it, you're treating them as humans and not specimens. I understand
Exactly.
the cases are increasing. Very easy for each one of us in today's time to become robotic about it. But just to take out time and appreciate something about your patient, it just makes you a healer more than a doctor. And I have been very blessed to have him in my life. And my medical oncologist was Dr. Sudeep. I'm sure you know
He's
about.
a super guy.
He's a super guy as well. I think all of you are superheroes. We just don't get to see your capes, but we see it in your smile, and you're such a healer. Thank you so very much
The pleasure
for
is
being
mine.
a part of this show. And truly, you're not just doctors, you are healers. And if there's one positive thing that you like to say and tell our audience, not from a medical perspective, but from a healing perspective, what would that be?
Pray that everything is fine.
Oh, that's so beautiful. I think believe in prayers, believe in
Absolutely.
positivity and affirmations.
At the end of the day, that's what takes you through. Spirituality and prayers, and
Wow.
Sometimes getting a little philosophical helps.
Of course,
So
of course.
I think do that when you're in solitude and
Yes.
and fight it from your mind rather than from your body.
That's so lovely. And coming from a doctor, he's also telling you to believe in spirituality, to believe in the goodness of life. Spirituality is nothing more than being human and humanity and having
Yes,
positive
yes.
affirmations.
There's a
Thank
saying,
you.
someday all of us will die, but let's live every day.
Oh, that's so beautiful. That's so beautiful. Thank you. That's a line to live by. Thank you so much,
Thank you
Dr.
so much
Senthil.
for having
Thank
me
you.
here. My pleasure.